Hey, I'm Dr. Craig Chappell at Intuit Medical, and today I wanted to talk a little bit about how osteopathic manipulation can be used to treat pneumonia. So we, like you, have been experiencing the inability to take care of patients secondary to the coronavirus. And in the past, in the history, osteopathic manipulation has been helpful at treating pneumonia associated with influenza. Theoretically, we could carry that over to any pneumonic process, so anything that creates a pneumonia or would require pneumonia, any virus that would do so. So I've had people ask, because I've had a difficult time treating them, because as we're following social distancing, just like you, it's hard to do hands-on medicine. So I wanted to give you some information that you may be able to apply to the ones you love or the ones around you that you may feel may do well with osteopathic manipulation or some sort of manipulative technique. And this stems from the influenza pandemic from 1918 to 1919, during which time about 1% of the world's population died secondary to side effects of influenza, a lot of which was pneumonia. But it was also found that the osteopathic hospitals at that time had a higher survival rate than those other types of hospitals. So it's been thought that maybe osteopathic manipulation was a possible variable that allowed for people to do better during that time. So I wanted to show you some simple stuff that you could do at home without hurting anybody if applied correctly. So the first thing I want to talk about is a rib raising technique. So we know that any pneumonic process or any pneumonia has to do with consolidation of illness in the lungs. So theoretically, if we could increase lung volume, increase the ability to breathe, that would also result in increased lymphatic flow. Increased lymphatic flow is how we fight infection, would result in a better outcome. So we know that lymphatic flow is a passive process, meaning when I breathe in, I create a negative pressure inside my chest, which assists with lymphatic flow. Lymphatic flow is not pumped back to where it needs to be, but we use our muscles to do it, we use gravity to do it, and we use the negative pressure inside our chest. But when someone's sick and they're not breathing very effectively, that makes it really difficult. So one way to do that is called a rib raising technique. So a very gentle process. So if you're working on somebody that's fragile or very ill, theoretically, if we assist in the respiration process, I would have them lie on their back. I would put my fingers between their ribs, and with very gentle pressure, I'm pushing downwards and outwards on the ribs. So it would look like this. I'm going down and out. Theoretically, if I do that in the back, if I go down and out in the back, the front raises up, which creates negative pressure inside the chest and allows for deeper respiration. So on the skeleton, if I were to show that, I'd lay the skeleton down. I'd come in from behind with my hands and just basically interlace my fingers between the ribs, and I would pull out and down, kind of at the same time, gently just raising the ribs with my fingertips. You don't have to be really aggressive with this to increase lung volume. So I'll demonstrate on an individual. All right, so to demonstrate that on a person, we're going to put our basically just gently slide under. Doesn't matter how sick the patient is, and you gently put an outward and downward pressure, theoretically raising the front of the rib cage, which will improve respiration. And you basically just walk your hands down the rib cage until you get to the bottom, and then you go back up and start over. Go all the way to the top and work your way down, doing the same thing. You see the patient not moving a lot, because I'm not putting a lot of pressure on the patient, and so it's a very gentle technique that you can use. You can do this process for anywhere for 3 to 5 minutes per side, and you can treat multiple times per day. So you do gentle treatments for short periods of time, multiple times a day, which can be helpful. All right. So we went over some rib raising techniques very gently for people that are fragile. If you have a patient that's a little bit more robust, more healthy, you're not worried about osteoporosis. So that gentle technique that I showed you before would be great for someone with osteoporosis who you're worried about cracking a rib or injuring a rib. You don't want to injure a rib because then they're going to breathe less. And so a more robust patient, you can get a little bit more aggressive. And one way I like to do that is this time using the patient's own weight and using this part of my hand. This is called the Thenar Eminence. I basically put that part of my hand on the rib angle, and with the patient's weight, with them on their back, I allow them to basically rock over the top of my hand and at the same time apply downward and outward pressure gently. So if this was the patient, I would have that, I'd just roll them over with their shoulder, put my hand onto the rib angles and just rock back, and at the same time pull down and out gently. I'm not leaning on them, not crushing them. It's just their own body weight allowing for that motion. And in the front, I'm basically gently elevating their ribs in this direction, which will theoretically create a bigger negative pressure, allowing for lymphatic flow and bigger lung volumes. So to demonstrate that other technique, what we'll do is I like to cross the patient's arms across their chest. And in this case, in all cases, I like the arm that's away from me to be the arm that's towards their head. So in this case, the right arm will be up as I'm treating the right side of the chest. And with this part of my hand, Thenar Eminence, I'm going to roll the patient gently over, so you can just basically grab the elbow, roll, so you're not putting a lot of pressure through them. Put the Thenar Eminence on the rib angle. The rib angle is the most prominent portion of the back. And so we're just gently put there on the rib angle, and I'm going to pull down as the patient rolls back onto my hand. And just keep doing that process. You're basically just walking up and down the ribs, putting that gentle pressure over. Don't lean onto the patient, so I'm not leaning on the patient. I'm just controlling the patient with my hand as we go back and forth. And you could practice this on a healthy person if you wanted to beforehand, and have someone practice on you so you can see what it feels like. But basically, you're just elevating the ribs in the front, depressing them in the back as we go down, which will create better lung volumes. And so you do this a few times on each side, and then you can repeat it later on in the day. So that's another technique for a rib raising technique. All right. So oftentimes when you have a pneumonia or a pneumonic or a lung process, you'll get congestion in your head and neck. And so theoretically, if we could increase lymphatic flow from the head and neck, and so we do that from the chest by increasing lung volumes, increasing negative pressure. We can also do it by mobilization of the head and neck, and we can do that gently. So the way I like to do this is basically, I'll have the patient lying down, but with basically my entire thumb, from my thumb to my Thenar Eminence, I'll place this on the patient's neck when they're lying down, and I'll basically, with very gentle pressure, grab the head and rotate it back and around my thumb and finger like this. So we're just basically putting gentle motion through the cervical spine. Nothing that's going to hurt anybody. If it's uncomfortable, don't participate in it. But you're basically just mobilizing each segment as we go down all the way to the thoracic spine where the ribs start. And so we're going to do that on a patient just so you can see what that looks like. And I'll do it. I'll first practice with the patient sitting up, and I'll show you how to do it with a patient lying down. But those three techniques generally will help a patient feel better and theoretically help them get through some sort of lower respiratory tract infections or illnesses, and you may find helpful. And like I said, my number one reason for doing this is because I'm having limited access to patients, but patients still need help, and I hope this helps you. Okay, so for that last maneuver I showed you, we're going to do it sitting up first, because this is a very easy way to do it. If the patient's too ill, I'll show you how to do it lying down as well, but I've kind of zoomed in so you can see this area. So once again, what I do is I use my thumb all the way to my Thenar Eminence, place it on the patient's neck. So my thumb's basically at the base of the skull, my Thenar Eminence is down towards the ribs. I reach across and I grab the patient's forehead and just kind of rotate around the tip of my thumb, not using my thumb as a poker to change anything, but using the entire surface, just a rounded surface for the cervical spine to roll over. And so up and down as we go down through, and then we change direction and do it on the opposite side, doing the same thing. So this is just a mobilization technique. All you're doing is mobilizing the cervical spine, allowing better flow of lymphatic drainage from the head into the chest, and from the chest out into this systemic lymph system, which will be discarded. So that's one way to do it. So the things that we've covered today are gentle rib raising techniques, which are most effective in fragile osteoporotic patients you're worried about injuring. You can do that with your hands on their ribs. And the other thing you can do is use your body weight to roll up over your ribs, which will also do the same thing in a little bit more aggressive manner. And then we talked about springing on basically the cervical spine to increase lymphatic flow, increase lung volumes, and hopefully decrease illness. If you have any questions, obviously, feel free to reach out to us, but I hope this helps you and your family get through the current situation. Thanks.